When a 3-year-old patient of ours developed a condition called mucositis, we knew we had to do more to help patients and families better understand what this is all about. I would never forget this mother's biggest shock when her daughter, who entered into the final stages of therapy, when things are supposed to get better, developed the worst case of mucositis she and I both had ever seen. It helped me, as well as the parent, to understand mucositis can happen at any given moment when you least expect it. It's unpredictable and can be quite scary when you're not expecting it. This is why education is crucial. Mucositis is a condition that happens to 1 out of every 3 patients who receive chemotherapy, regardless of age. It often depends on the type of chemotherapy given, such as methotrexate, doxorubicin, or cytarabine, to name a few. We see it even more frequently in patients undergoing transplant. Mucositis occurs when tissues in the mouth, nose, and even intestines become inflamed and sores develop. There are 4 stages of these sores that can range from mild to severe. These sores usually develop 1 to 2 weeks after chemotherapy begins while a patient is at home and can cause pain while eating, drinking, swallowing, and even bleeding. GI or intestinal mucositis can cause abdominal pain, nausea, vomiting, diarrhea, and can sometimes lead to a serious blood infection. Unfortunately, mucositis can be very painful depending on the severity. It's actually one of the most agonizing parts of the treatment process. The good news is there are some steps that we can take to help prevent mucositis. Generally speaking, good hygiene is the best way to prevent it. Your nurses will take you through steps to rinse your child's mouth with your choice of either baking soda or salt water. It's highly important to follow these recommendations for the best chance of preventing mucositis while you're receiving therapy. Because not only does mucositis hurt, but the longer it lasts, it can delay your treatment.
Good oral hygiene can help manage or even prevent mucositis. Have your child brush his or her teeth 2 to 3 times a day with a soft toothbrush and fluoridated toothpaste. Children under age 6 should have an adult help them with brushing. In addition to your child frequently rinsing their mouth with salt water or baking soda, your doctor will provide a medicated mouthwash to use at least 3 times a week to reduce bacteria that can lead to infection and cause fevers when your counts are low. This can make you vulnerable to infection and may require you to be readmitted. Prior to starting cancer treatment, it is important to have an evaluation from your child's dentist. Your first assessment should happen before cancer treatment starts in the hospital. Eastman dental providers at the hospital will be available to follow you throughout the course of your treatment and to provide easier access to care. Dental visits should be scheduled every 6 months, depending on blood counts and treatment. Speak to your healthcare provider prior to making an appointment with the dentist, since you might need prescription for antibiotics. If mucositis does occur, there are steps you can take to ease the discomfort. We recommend drinking room temperature or cold fluids with a straw, eating softer or blended foods. Avoid eating hot, spicy, and acidic foods as it can irritate the sores. Use of medicated mouthwash can reduce bacteria, especially since it may be hard to brush. Talk to your doctor if you need oral pain medications prescribed.
If your child develops painful mouth sores, has trouble swallowing, and is not eating or drinking, has fever, severe diarrhea, abdominal pain, and/or is bleeding, please contact us right away, because your child may need to be admitted for close monitoring and supportive care.
We work as a team and are here to help you and your family at the University of Rochester Medical Center.